Welcome back to Acadiana Live. February is Heart Month. Today we get to meet Tiger East and hear why he says it's so important to listen to your body. We are concluding our heart health series with Our Lady of Lourdes Health today, visiting with an actual patient of Lourdes, Mr. Tiger East. And Mr. Tiger, let's just start and get to know you a little bit. Tell us about you and your family.
I am married, and we have 4 children, 2 boys and 2 girls. And we have 9 grandchildren.
And let's talk about your heart health journey, your story from the beginning. One thing that a lot of people think is there's going to be some type of pain when you have heart issues, or there's going to be all of these major symptoms. What were your symptoms like in the beginning?
My symptoms were night sweats and extreme tiredness in the afternoons.
So nothing too serious?
Nothing as far as any chest pains, no shortness of breath or anything like that.
And what made you initially go and seek professional help?
Well, I saw the cardiologist for the first time 5 years ago when I had a resting heart rate of 42. And my doctor was concerned about it, so I did see him. We didn't find any issues at that time. This time I had an appointment with the cardiologist, and my wife said, look, what's happening here is just not normal. And so he recommended that we do the nuclear stress test, which we did. He found some issues with that, and we did the angiogram. And once we did the angiogram, he found the 3 blockages, but then Dr. DeWitt found the 4th during surgery.
And what was that like, kind of mentally, whenever this was discovered? What was going through your mind?
Well, as I told my wife, it was as if the doctor had hit me in the head with a brick. I wasn't expecting it. I did not feel that I was in any health situation that was going to bring this about. However, you know, I knew that, as I told the doctor, I have grandchildren from 2 to 22, and I wanted to see all of them grow up.
And he said he was going to take care of you.
And he said he was going to take care of me.
And since your quadruple bypass surgery, what has the recovery process been like for you?
The first 6 weeks were really rough because I was not allowed to drive. But after that, I started my cardiac rehabilitation. I do that 3 days a week, Monday, Wednesdays, and Fridays, and normally that'll take anywhere from an hour to an hour and 20 minutes, mainly to keep me physically moving. And when I'm not there, then I'm doing those things at home.
So the biggest thing is to just keep your heart working and keep it pumping and stay moving.
Correct. Right.
And one thing that Our Lady of Lourdes Health really just wants to stress is that you don't have to have some major symptoms, anything that's abnormal. They want people to go and see a doctor and get help, check things out, see if everything's okay. What do you have to say to people who are stuck on this belief that there's going to be some dramatic thing like we see in the movies whenever there's heart issues?
And that's the thing. You know, I didn't suffer a heart attack. I did not suffer any heart damage. And I think it's very important that those people who may have the same symptoms that I have, that they need to get it checked, you know, and looked at, because I didn't think there was anything wrong.
Well, Mr. Tiger, thank you so much for chatting with us today.
Well, you're welcome. Thank y'all.
All right, Mr. Tiger East, an actual patient at Our Lady of Lourdes Health. Again, any abnormalities that you're experiencing, make sure you go and see a physician. Again, you can learn more at lourdesrmc.com/heart.